Hello, everyone. My name is Ruhi Sahu, and I'm a student at The Ohio State University, and I have the pleasure of being your host this afternoon for our session titled An Overview of Dentistry and Healthcare. Dr. Olivia Sheridan is an Associate Dean of Admissions at Penn Dental and has actively been involved in the dental profession since 1974. Dr. Beverley Crawford is an Associate Professor and Director of Diversity and Inclusion at Penn's Dental School and practices as a general dentist in the school's faculty practice. Attendees, just a reminder to feel free to put any questions in the Q&A section throughout the presentation, and we can get to them soon after. Please help me in welcoming Dr. Sheridan and Dr. Crawford.
Hi, everyone. I'm really pleased to be here. I'm Dr. Olivia Sheridan, and I'm super happy that my colleague, Dr. Beverley Crawford, is on this call. We have had the pleasure of working together for probably more years than we're going to admit. We also teach clinical dentistry at Penn Dental Medicine, but we really want to talk about the profession of dentistry today. And we'll cite some of the examples of what we're doing at Penn, but those are really examples that we hope are available in most programs. So I would like to share the screen and hopefully give everybody an overview of what our profession is, why we love it so much, and what are some of the characteristics of dentistry, and what makes it a very different education from models that you're probably familiar with. So I'm going to share my screen. I have a few slides that will give you some facts. Certainly, since this is recorded, you may use the slides as you see fit. And if you get in touch with us, I'm sure we'll be more than happy to also share them with you. So first, let me share the screen and we'll start our presentation. Dr. Crawford, do you want to add anything while I'm playing around with technology?
No, just echo your words. We're grateful to be here and happy to be invited, and hopefully we're able to share and give some clarity to the overall process of becoming a dentist and what happens in dental school.
All right, so I can see my screen. I'm hopeful that everybody else can as well. Certainly shout out if you can't.
We can.
Perfect. Okay, so first of all, I want to start by sharing some resources. For those of you who have already started looking at our profession, some of these resources may be familiar to you. But for those of you who are really checking us out to see what dentistry is all about, I really want to make sure you have some great resources. First of all, your pre-health advisors are going to be wonderful resources for you. We do hear that pre-health advisors tend not to know quite so much about the nuts and bolts of applying to dental school, but they really do have a fair idea of who you are and what your strengths are, and some of the ways that they can help you sort out some of your questions. So start with your pre-health advisors, first of all. Also, dental school admissions officers and admissions offices are very generous with the help that we want to provide to students. We pretty much all have general portals that you can direct questions to, and there are assigned people in most offices who interface with those questions. So use the resources there. Of course, I don't have to tell you about using the internet because certainly we're doing that right now. ADEA, the American Dental Education Association, is a wonderful resource. Put that at the top of your list. The ADEA has members from every single dental school in the country. You can check out every single school in the country. We all list our programs. Most include virtual tours within the portal of ADEA. ADIA is also the organization that you'll eventually be using to make your applications to dental schools because they handle the ADSAS portal. So this is a major clearinghouse of information. Stay tuned, visit ADIA periodically because there are events called ADIA Go Dental, where we have virtual fairs. We started those even before COVID. And this allowed students all over the world, really, to visit our programs during virtual dental school fair days. So get into ADIA and start to look at some of these. Certainly the American Dental Association is a great fund of information. They can talk about different programs, but you'll also find out more about the specifics of dental practices. Who is practicing where? What specialties are being practiced? And where are underserved areas? Where are there programs that are very specific and guided to individuals who might be community-based, individuals who might have specific needs? The ADA tracks all that information and is a wonderful source of information to you. And finally, there's ASDA. ASDA is an arm of the ADA, but it is for dental students and pre-dental students. You may join as a pre-dental student while you are an undergraduate, and they have events throughout the country at dental schools all over where you are able to go to a dental school for a day or perhaps even a week and try on dental education, find it out. Dr. Crawford partners with our ASDA group at Penn Dental to provide some try-on days. Dr. Crawford, you want to comment on some of the things that you've done with the ASDA group?
I can cover that when you're finished.
Oh, okay.
Okay, yeah.
All right. So who are dentists? Well, most of us have an idea of a dentist as the person that we see maybe twice a year or once a year, and it's the person who checks us for cavities. Maybe you've had your wisdom teeth extracted. Maybe you have members of your family who have had dental treatments of things like crowns or caps and bridges and implants. And so we all have an idea of who the technical dentists are and some of the things that we do in practice. But you also might think that we are also interdisciplinary pioneers. We are the profession that since its beginning has worked with other healthcare providers, certainly with physicians, because all of our patients come with intact medical histories. And we often have to interface with physicians, nurse practitioners, nurses, to provide safe and effective dental care for our patients. Certainly many oral conditions that we discover in our patients have full body repercussions, and we work with physicians to effectively manage some of their systemic diseases. We're family doctors. We see the entire family, many of us. I'm sure Dr. Crawford has had the same experience I have of seeing everyone from the littlest grandchild in the family all the way up through the grandmother and the great-grandmother. Certainly, I have had that wonderful experience in my own practice. And we are often the family doctor who is seen most often for all of our families. We are researchers. Many schools like Penn Dental Medicine derive a substantial portion of their budget through their NIH and NIDCR, American Cancer Society funded research. We have a research team at Penn right now that has created one molecule robots that can, under the use of an intraoral magnet, completely remove the dental biofilm from teeth. Stay tuned for that on your next mouthwash. We have researchers right now who are developing entire protocols for the safe and effective treatment of cancer patients so that they don't develop devastating mouth ulcers and the ability to eat. We have translational research at Penn right now that would take your breath away. And certainly we have researchers who are looking at the next new biomaterial. We are technology pioneers. Many of you might have visited an office of a dentist, and if you haven't, you really should, who are using scanning devices. I just saw a figure this morning when I was on the ADA website that showed that almost half the practices in the US right now are using direct scanning devices to make impressions that way, rather than with the putty that Dr. Crawford and I were trained on. We are advocates for public health. We have a presence in every single state across the country and nationally. We advocate for our patients. We advocate for their care. And by the way, we have been nominated and as the most respected profession by the US News and World Reports, certainly in 2020, but for most previous years. So we are a profession that is very respected. So what are the 10 great reasons? I pulled this right off the ADA website, and I think these are pretty wonderful. Service to others is certainly what motivates many of us to come into dentistry. Balanced lifestyle is very, very important. Most of us can successfully practice on the hours and the days that we have all set out for ourselves. So there is a work-life balance that's available in dentistry that is in many areas of healthcare. We really want the empowerment of our patients. Our decisions for care are made with our patients, discussed with our patients. And we believe that our patients help us in some of the most important decisions in their care. Certainly, I talked about technology and research, and boy, is this an area that is growing in leaps and bounds. I tell students on the clinic floor when I teach that 100% of what I currently teach in dentistry, I've learned since I completed my residency. I've completely replaced all the knowledge that I gained during my training with new knowledge, new research, new technology. We are the pioneers of prevention and education. If you don't know it, you should know that we are considered one of the #1 public health advancement of the 20th century in the US. Why? Because of fluoride. Fluoride was introduced in the water supply in 1945, and it has led to a major decrease in the number of cavities that people get. Creativity is wonderful. Being able to restore a smile, being able to make a smile more beautiful is a very, very compelling reason to be a dentist, and certainly one of the things that gives me most pleasure. The success potential is there. I'll give you some figures about what dentists can expect to earn. Certainly disease detection, I just touched on that a minute ago. Certainly many of the systemic diseases are first detectable in the oral cavity. And many of us detect for the first time with our patients things like diabetes, things like autoimmune diseases. We see sometimes first in the oral cavity. Leadership is especially important in dentistry, and we'll talk about that a little later. And certainly the ability to be self-employed is also something that's very, very important in dentistry. So what are the specialties that dentists practice? You know, we all have an idea of who the general dentist is, and maybe you've been to your general dentist throughout your life. Maybe you started off with a pediatric dentist, and maybe you might have interfaced with an oral surgeon to have wisdom teeth removed. But did you also know that there are other specialties within dentistry? Dental public health is a specialty that is very important at a school like Penn, where we graduate students every year, not only with their DMD degrees, but with MPH degrees. And what do? They work in federally qualified health centers. Many of our recent graduates have started federally qualified health centers to provide care for underserved populations. Endodontics is a specialty in dentistry where dentists do root canals. And boy, if you think that that hasn't changed in the last 10 years, every endodontist now uses microscopes. They use materials that were never even thought of as recently as 10 years ago. They can do amazing things. Oral and maxillofacial pathology. This is a specialty that is primarily hospital-based. And these are people who specialize in the pathology of the oral cavity and head and neck cancers as well. Oral and maxillofacial radiology is also an area that's exploded recently within dentistry. We now routinely 3D image our patients for procedures like root canals, like orthodontics, like implant placement. And that's all been made possible through research in oral and maxillofacial radiology. Orthodontics and dental facial orthopedics, you might have had this experience so far. Certainly, orthodontists not only move teeth, but they're trained in the development of the entire head and neck region. Prosthodontics and maxillofacial prosthetics are people who have specialized in the replacement of tooth structure or even facial structure. So patients who have lost eyes, noses, parts of faces to perhaps trauma or cancer, prosthodontists and maxillofacial prostheticians replace those structures, and their work is amazing. Periodontics is a specialty in dentistry that has been around for a little while, and periodontists primarily practiced in restoring the health of soft and hard tissues, but also in the placement of implants. Oral medicine specialists primarily work in hospitals. They work alongside their physician colleagues to safely and effectively manage the oral and head and neck region of patients who are undergoing cancer therapy, who have immune disorders, or who are so medically fragile that they need co-management with physicians in order to have safe and effective dental treatment. And certainly pediatrics, who manage dental care for patients from birth, probably till the eruption of their permanent dentition. But the pediatric dentists usually work both in private offices, but also in hospitals to provide care for medically fragile pediatric patients or patients who require hospital care for their treatment. So what's dental education like? Well, they're currently 66, soon to be 67, and I've heard it's going to be 68 even in the next year or two, dental schools in the US. Right now, there are about 6,300 seats available. That was for 2019. Bump that up by about 100 for 2020. I don't have the statistics yet for 2020. So for the last cycle for which I have statistics, there was about 10,500 completed applications. Now, 10,500 completed applications for about 6,400 seats means that the acceptance rate in dental is actually pretty good. The number of applicants decreased for the last 10 years, overall about 18%. So you had fewer applications over a 10-year period for about the same number of seats. Interesting fact, last year, we actually saw the national applicant pool grow. I don't have the final stats, but we look to be growing and going through a little bit of a growth spurt in dentistry right now. So stay tuned. Who's applying to dental school? Nationally, in 2017 was the first year that the male-female ratio was 50-50. That was the first time ever. In 2019, women started to take off a little bit more than men. And it looks like that figure will, excuse me, stay in the low 50s to the upper 40s over the next several years. That seems to reflect also, though, who's graduating out of four-year programs. This slide is a busy slide, but I think it's a slide worth showing. The dental school population over a period of about 5 years. So we're showing 2013 versus 2018. And we're showing the demographics. What you should see is that the pool of applicants, even when it shrank a little bit over that period, what we saw was that the pool is slowly becoming more diverse. And Dr. Crawford will probably talk about that in a second. You can see, however, that we've got a lot of work to do in this profession. We are lacking many role models. We are lucky at Penn because we have some role models, but we also have seen a nice increase in the diversity of our student body over the last couple years. What that translates, we hope, is that more people will be attracted into this profession. What you should also know, and I don't have statistics, is that a significant number of our students who enroll at Penn are first-generation students. We do track those data, and we see that about 20% or more of every entering class is composed of first-generation students. And that is a significant factor in the diversity of our student population. So what did dentists earn? This is a very big average. This statistic came from the ADA. So they are claiming that the average income for dentists in the US in the year of 2018 is about $212,000. Now that's across all specialties. So you might have a specialty like oral and maxillofacial surgery or endodontics, where the annual or average income is probably closer to $500,000. General dentists are going to skew a little lower. They might be a little closer to maybe 175, depending on the area and the type of practice. What do we know about funding dental education and salaries? We know that we have the absolute lowest default rate on school loans, professional loans, than any profession. Our default rate is extraordinarily low. And as a result, our graduates have done very, very well in repayment and in their ability to finance their dental educations. So what is a dental education? It's real different from undergrad, and it's very different from the medical school model you may be familiar with. It is 4 years. And your first 2 years, it's often combined with medical students because we cover all of the same basic sciences that the medical students do. So you may find in a dental school program that all of the dental students and medical students are co-matriculating over the first 2 years. We do a little bit more work, however, during our 4 years, because on top of that 2-year basic science curriculum you're doing with your medical school colleagues, you're also taking all of your preclinical courses. Dr. Crawford teaches the first 2 years clinical courses. And what are you learning? You're learning all the fundamentals of general dentistry. You're learning how to do a filling. You're learning how to do a crown prep. You're learning how to make a denture. You're learning how to make a partial. And you're doing this on top of the curriculum that your medical school colleagues are taking. You also, in your 3rd year in most schools, become primarily responsible for your patients. You're assigned patients in your 3rd year in dental school. And what are you supposed to do? You manage all of their care, from their diagnosis to their treatment planning and the delivery of their care, whatever those patients need. You are required to manage their financial record. You're required to understand their insurance. This is a tremendous responsibility, and it is making our dental education very, very different. We are very procedure driven in dental education, so that depending on the school, you may have specific requirements. You need to do this many crowns. You may need to do this many dentures or this many fillings in order to graduate. At Penn, we do more of a portfolio review, but you are also required to show competency in every single procedure that determines the role of a general dentist. It is the goal of every dental school in the country to graduate a competent beginning general dentist. But that doesn't mean that you might not be doing a specialty. Certainly at most schools, you will do specialty rotations. So on top of your clinic responsibilities for your own patients, you may be required to do rotations in oral surgery, in endo, or in ortho, or in pediatrics. And this is how you develop your expertise in those areas. It also exposes you to those specialty areas. And many students find that they really love a particular rotation, and that becomes the determining factor for applying to a specialty program. Like most professions, you are required to pass national and regional boards. Up until this year, there were 2 sets of national boards that the dental students across the US were required to pass. Now that those boards have been combined, and at the beginning of your 4th year in dental school, you take a board exam that examines your expertise in the basic sciences and how you apply that knowledge clinically. The regional boards are determined by the particular state that you want to practice in. They determine which exams that you are required for licensure. Those are typically clinical exams with limited didactic versions. And as I say, every state is different, including some states that don't require regional boards. This is our preclinical lab. This is taken right out of our preclinical lab at Penn. You can see that students are practicing their procedures, working with an instructor. And you can see that they are practicing them on these wonderful rubber heads and bodies. But this is very much simulating what they will be doing in clinic in a very short period of time. This is something that I took right off of our clinic floor. This is a faculty member working in endodontics with a endodontics resident. You can see that they're using a microscope. They're using a 2-dimensional image here, but I can tell by the image in the corner that that was developed using 3D technology, and that resident is able to rotate that image to see that particular tooth in all dimensions. And that's just done in our regular endo clinic here at Penn. So what are the characteristics? What set us apart? Well, first of all, if you haven't guessed by now, we love to talk. Social skills are at the top of our list. We love our patients. Our patients are awake the whole time we're working with them. A short dental appointment is half an hour. Many of our dental appointments run for a few hours at a time. And our patients are there and conscious and talking to us and interacting, sometimes with some things that don't taste so good, smell so good, or feel so good. And our ability to make our patients comfortable, not just from the physical sense, is really important. Excellent science preparation. Certainly, we need to continuously build on a very solid scientific knowledge base throughout our careers. Academic maturity. It's hard to balance all of your science courses, all of your prerequisites, on top of learning your preclinical skills and clinical skills. So academic maturity really is important. Highly organized, if you can't tell, time organization, schedule organization. Hand skills and dimensional analysis. Even if you like to cut hair or you like to apply makeup, those are hand skills and dimensional analyses that really come into play in dentistry. Certainly leadership, we work with assistants, and being able to lead a team and teamwork are very, very important to the skill set that we bring to the table. We're multitaskers. Many of the times that we're working with a patient, we have a patient in another room with a hygienist or with another staff member that we then need to chime in on. We're running an office, we're running a business. And even if it isn't our own office or business, we're participating in business and office decisions. At the same time, we're delivering very wonderful care. Curiosity is super important. Being curious about how to do things differently, learn new ideas, are wonderful attributes to bring to the table. Community focus is of very high value. Why? Because we are working in the communities in which we live. We are community leaders. We are looking out for our neighbors. Our neighbors are our patients. And having a community focus is enormously important. And certainly problem solvers. There are many times in my practice day, and I think Dr. Crawford would say the same, that we scratch our heads. How am I going to do it differently this time? And being able to reflect on different ways of solving problems is tremendously important in this profession. These are all characteristics that make for really good dentists. What are the majors that most of our students have when they come to dental school? Certainly bio is right at the top of the list. That's very, very common. And any of the other sciences certainly lead the way, as well as some of the related health profession programs, public health. Certainly, we have many students who have earned hygiene degrees or BSNs who then come to dental schools. But what are some of the other majors? Psych, social sciences. Business is actually, I'm surprised it's 1.9%. I think we see a little more than that at Penn. But all other majors, if you looked at my bio, you saw I was an English major. I certainly needed to do some additional science courses, but really, the major that you're passionate about is what's important. Certainly you have prereqs. The same prereqs that would entitle you to apply for medical school are generally true in dentistry. Certainly bio, chem, gen chem, organic chem, all with labs, physics, biochem, and those are the basics that are required. But on top of that, what do we encourage? Anatomy, physiology, any upper level science courses that are going to make you a more rigorous student. So what is the application process? As I said before, it is the common app is called the ADSAS application, and it's done through the IDEA portal. Now, what does that common app ask for? It asks for your hours in shadowing, research, community service, employment history, extracurricular. I always tell people who are applying, look at the application. The good news is that IDEA opens up the portal for a soft entry 2 weeks before it actually opens the portal for actual submission. You can go in and play with the application, and I would encourage you to do that because you're going to forget some things in your application. And so open that up, look at it, and start to work on it. Now, what are the other requirements in that application? Letters of recommendation, certainly from your pre-health advisor if you have one, but also people who know you well. Perhaps a dentist where you've shadowed for many, many hours, or perhaps a coach. Certainly, if you've worked in a lab with a researcher, those are all great letters to get. Your personal statement, yes, that really is important. Why you're making this application, what you're bringing to the table. Demographic information is very important. Why? because we want to be inclusive in our programs. And the ADSAS application will ask you very specific things. At our school, we have a supplemental application, as most programs do. We're going to ask for additional demographic information because of the types of grants that we get at Penn. We need to show exactly who our students are, and any additional information. Let's go back to shadowing for just a second. We know about COVID. We know about how hard it is to shadow. What I found this year is that there are a couple of virtual shadowing companies that you can find online, and they're doing wonderful things. There are things like Coursera. I encourage you to look at Coursera, even if you're still just checking out the profession, because in Coursera, you have 2 courses that were developed by Penn, but there's also a course from Michigan, which is excellent, all in the Coursera portal. They're free, and they'll show you a lot about this profession in detail and some of the really interesting things we do. So what are the requirements? We do a holistic review. Most schools do. What does that mean? We don't have thresholds. So we don't have a minimum GPA. We don't have minimum DAT scores. We certainly love our applicants to be talented, but we also want to know, what has that applicant done before? Where did they come from? What has led to this point in their life? Because that's called a holistic review. And there are many things in that make a candidate who might not have numbers that are exquisite, but make them an exquisite candidate to us. So holistic reviews are done, as I say, by many schools. And we care very deeply about the journey that our students have traveled to get to that day. Cognitive factors, yes, science and general GPA. We do give full credit for any credits earned in community colleges or even with APs if they appear on your transcript for credit. We certainly look at pass-fail. We know about COVID. We know how many people have pass-fail on their applications in their prerequisite courses. We look at that pass-fail in the context of the entire application. So what if you have a weak transcript or you're just not academically ready? That's where master's programs are wonderful. Penn has just started their own master's program, but you'll see many dental and medical schools across the country have master's programs where you co-matriculate with medical and dental students, and you take portions of courses, and you can prove your academic rigor in these master's programs. You might, if you don't have enough sciences like I didn't, you might complete a post-bac program that give you some of those prerequisites. You also will be required to take a DAT exam. It's much like the SAT or ACT. There are prep courses, there's a boot camp, there's a DAT prep book, but you really will find that the applications are fairly straightforward as described in ADIA. And that is where I am going to end and let Dr. Crawford take over, and she can tell you about some of the specific things we're doing at Penn.
So, thank you, Dr. Sheridan. There were 3 questions in the chat that I answered, but the last one you might, if you might want to answer that while I get set up to share my screen.
Okay. Oh, Q&A, I see. I'm going into the wrong. Here we go. So how can high schoolers show dedication to dentistry during COVID when applying to 7-year biodental programs? How do we compensate? So much in the same way that our students who were currently in undergraduate programs show dedication. There are some virtual shadowing spots that you can look at. You can find them online. I believe one of them is called Dental Shadowers. If you Google that, they should be relatively easy to find. The Coursera courses are wonderful. When we're looking at applicants to the 7-year program, we are looking at how well they know the profession. Do they really know what they're getting into? So demonstrating that you've investigated the profession is really important. I would also tell you, both as a biodental application, but also as an undergraduate, call your own dentist. Ask if you can do an interview in a format like this. And then after that interview, ask who their friends are and if their friends would be available for the same thing. So those are all things that I would suggest to somebody who's checking out the profession.
Everyone see my screen?
Yes.
Great. So I am going to be a little bit specific in the presentation. I'm going to use some things that we do at Penn Dental. And I'm absolutely sure that most of these exist in other schools as well. So be sure to look for these types of things when you're looking at the schools that you're interested in. So how do we support our students? And all the dental schools, we all know how stressful the dentistry as a profession is, and you have some of that stress in dental school as well. So how do we support our students? So at Penn Dental Medicine, the first thing you'll run into as an incoming student is a course that I created with Dr. Hillier from SB2, or the School of Social Policy and Practice, and it's called the Penn Experience course. And that course is a 20-hour asynchronous course that you do in the fall of the incoming your first year, and it welcomes you if you're not from the area. It welcomes you to Penn. It welcomes you to Philadelphia. We talk about things like implicit bias and microaggressions, racism and other forms of oppression, gender identity. Just basically, we make sure that everyone coming in is at the same level as far as learning how to be welcoming and inclusive and respectful of each other. I work very closely with the Office of Student Affairs. Most dental schools will have an Office of Student Affairs, and the Office of Student Affairs helps students become settled in dental school, provides a lot of support systems and resources. They oversee things like mentoring of the students, peer mentoring, faculty mentoring. And if there are any concerns about inclusivity of bias, that's where the students would go, to the Office of Student Affairs. The Office of Academic Affairs oversees the curriculum, the different courses. If you're struggling a little or having any concerns in classes, that's the office you would go to. There's always an Office of Development and Alumni Relations that helps create a mentorship relationship between our students and alumni. And also they help us host things like cultural celebrations, conferences, support our students in similar ways. We have peer mentoring and faculty mentoring. It's also part of the Office of Student Affairs. But the Penn Experience at Penn Dental is really our signature course. So that's something you can find out a little bit about it online, and it's something that I'm happy to share more about with you. We have student organizations. Here are some of the student organizations. We have the Hispanic Student Dental Association, the Student National Dental Association, the Indian Students Dental Association. Mentorship is a mentorship program between Penn Dental Medicine and one of our Philadelphia high schools. Breaking Boundaries works with first-gen students. We have the Penn Dental Women's Network. As Dr. Sheridan told you, the demographics of dental school are changing to where there are more women applicants and more women accepted in attending dental school. The Penn Dental Pride Alliance is our LGBTQIA+ organization. The Art Club, Chinese Dental Association. Brown Sugar is our Indian Students Dance Association. Interestingly enough, they're dental innovators, creators, and entrepreneurs. We have meditation, meditation, it says mediation, but it's actually meditation clubs. There's something called the Penn Dental Happiness Project, and all of these clubs have faculty advisors. And as I said before, these are things that exist in many, many dental schools. The faculty advisors provide another layer of mentorship for our students. So not only can you have a personal faculty mentor, but you also have faculty advisors in any organization you join that can act as faculty mentors as well. We have cultural and religious celebrations. We celebrate Black History Month, Diwali, Hispanic Heritage Month, Pride Month, Chinese New Year, Islamic New Year. All these cultural and religious celebrations, I work with the Office of Student Affairs and the Office of Alumni Relations to make sure that everyone feels supported and everyone is invited to all these cultural and religious celebrations. And it's also part of the education. So you can learn about the students that are attending the university with you. Another thing that I work with the Office of Student Affairs is conference travel. We have travel awards where our students travel to different conferences all over the country, and they're able to network and meet other students like themselves from different dental schools. When you go to these conferences, you'll meet a lot of other students like yourself, and you can spend some time comparing notes. Everyone thinks that their dental school experience is just the worst or just the harshest or it's pretty stressful. But when you go to the conferences and you're able to speak to your students in similar classes that you're taking, then you get an understanding that dental school and dental education everywhere is a little hard and it's a little stressful. So that's why they're prerequisites, so that when you, Dr. Sheridan spoke about the prerequisites, that's to make sure that you're prepared when you come to dental school and you're able to thrive and do well in the dental school clinics as well. Another thing that the Office of Diversity and Inclusion, of which I'm the director, I work with student initiatives, is we have pipeline and pathway programs. Dr. Sheridan mentioned the ASDA group that sponsors a program, and it's called ASDA Weekend. So for a weekend, they invite students, pre-dental students, students who think they're interested in dentistry. They come to the dental school for a week. Of course, all of this is pre-COVID. They come to the dental school for a weekend. We make recommendations of where they can stay, and they do some of the activities that you see here. What you see here mostly, though, are our high school programs. This is the summer mentorship program. It's actually sponsored by the University of Pennsylvania Provost Office for 10th grade students. So imagine a 10th grade being exposed to the dental profession. It gives students an idea of what they need to do in high school to prepare for undergraduate college experience and to give them a head start on their way to dental school. Quite a few of these students have matriculated to dental school. And actually in 2019, one of our summer mentorship students graduated from Penn Dental Medicine. The Introduction to Dentistry program is for pre-dental undergraduate students. And this year, we were actually able to have two in-person sessions for about 30 students. And we had to make sure that everyone was vaccinated. Everyone wore masks throughout, but we had faculty who were willing to give their time, not only to oversee the program, but also to provide lectures. It's once again making sure that students who are interested in dental school have an idea of the rigor that's involved in being a dental student, but also a reminder of what they need to do as undergraduates to prepare for dental school. We also have a program for dental students who are interested in our postgraduate or residency programs. And this is called the Penn Residency Education Preparation and Support Program, PREPS for short. And we have students that come and spend the week visiting our specialty programs. And they get an idea, of course, of what the specialty programs involve. They meet the course director, the program directors. They're able to shadow the incoming first-year residents. And this encourages them to apply to our residency program. So that was just a very short presentation of what we have at Penn Dental Medicine. But as I said before, many dental schools have similar resources for dental students. And so just be sure that if this is something you're interested, if these are the types of resources that you would like to have and take advantage of, make sure that they are offered by the schools that you are interested. Of course, we'd love to have you look at Penn Dental Medicine. We think we have a really great program here. So thank you for your attention, and I'm willing to answer any questions you may have.
Perfect. Thank you so much to both of you for those amazing presentations. I know I learned a lot, and I'm sure all attendees did too. So we do have a couple questions. I'll just get right into it. So one question is, how is dentistry different from MD and DO with its approach?
Well, I'll take that, and I think Dr. Crawford can chime in too, because she teaches in the first 2 years in the preclinical programs. So I think that one of the take-home messages I would have is that dental education is tough. You are essentially doing what you would be doing in a medical school program, in addition to earning all of your dental skills. So it's almost like an education program with a residency combined, because you have primary responsibility for patients and you are required to complete procedures. What I should have also mentioned is that when you graduate from dental school, you are able to go out and practice right away. In medical school, you really are required to do an internship and or residency for sure. In dentistry, you actually can go out and practice immediately after graduation, after you've completed your licensure exams. Many graduates do exactly that. You can look, when you start to look at programs, to see how many or what percentage of the graduating class enters an advanced training program. At Penn Dental, it's well above 85% every year are going into postgraduate training programs. Now, the interesting fact is that about 50% of those persons are actually going into general dental programs where they're getting additional training in general dentistry. The other 50% of those students are pursuing specialty degrees. So that information is very available on the IDEA website. So it's a very different type of education. The interesting thing also is that many states, a few states across the US have changed their model and required an additional year of education, meaning a 1-year residency in general dentistry in order to be licensable in that state. New York State being the prime example. Delaware has had that requirement at least since the 1970s, where an additional year is required. And more states are looking at that additional year of training. But we are really practice ready when we graduate.
Thank you. The next question is, what kind of internships and research opportunities should we look for as pre-dental students?
So research is an interesting thing. It's not required, okay? Many pre-health advisors would say, oh, you should do research. It's really not required for entrance to dental school. Now, many students come with research experience because they're interested in it. But what we always advise our applicants is, don't do research if it's not interesting to you. We'd much rather see you go out and get involved in your community, because that's a really important piece of dentistry. Or do something that you're really passionate about. But research opportunities, if they're there on your undergraduate campus and they're appealing to you, go for them. Internships, in terms of internships in dental offices, you're not really going to be able to do much hands-on. Most states are very restrictive in how they let you do hands-on care for patients, but finding some significant time in a dental office is always useful, so that you really understand the profession. We do know with COVID that that's less and less likely, but finding things online that you can participate in, boy, have I seen some great examples this year.
Perfect. So we are nearing the end of our time. Thank you so much, Dr. Sheridan and Dr. Crawford, for that amazing presentation. Attendees, if you would like to provide your feedback, we would love it. There will be a short anonymous poll at the end of the session, which will come up soon. Other than that, be sure to come back at 6 o'clock in a few minutes for our next session, A Future in Dermatology with Dr. Collins. Also, for Dr. Crawford and Dr. Sheridan, there are 2 other questions that we weren't able to get to. So if you are interested in providing answers to those, you can go ahead and type them. I'll leave them open for you.
Thank you. And thanks for attending, everybody. I hope we were able to provide some good information for you.
Yes, thank you very much. This was a pleasure, and we hope to be able to interact some more in the future.